I'm actually gonna try and get through this without throwing up. I just went to go renew my healthcare, and as we know, there's been some changes with the healthcare system under the recent administration. And if you are someone that voted for this administration because of their economic policies, I would like to tell you that my healthcare, oh my God. I get my healthcare through the New York State marketplace. I get the catastrophic plan, meaning like the lowest plan. Meaning if I want to go and get my eyes checked, I have to pay out of pocket, but I just want insurance in case I get hit by a bus, okay? I got that through Anthem Blue Cross Blue Shield last year and paid $330 a month for nothing, for bare bones. If I went to the doctor, I still had to have a copay. When I had to get like weird surgery on my foot, I had a copay. That same plan, $805 monthly. $805 monthly for a catastrophic insurance plan. They no longer offer the catastrophic level. They now call it bronze. $805.
1 week after losing my health insurance, I went to the ER because my fiance and I thought I was having a heart attack. I wasn't, thankfully, but I just got the bill in the mail that I have been awaiting, and I'm really freaking out. I got it last night and decided to open it this morning. So I'm in between jobs. I had a job lined up because I had a great job, and then it was time for me to leave and move on to a different position, and had a new job. Then they went on a hiring freeze, so they didn't onboard any of us. So since then, I've been applying hundreds, like I apply all day long. I had some interviews this week. I think they're going well, but I know that I'm probably not going to be able to pay for this, and I'm truly so scared to do this. So I thought I would open it here with you guys for emotional support.
Now, this is absolutely insane. And before we even dive super deep into this video, this is what so many Americans are going through right now. This is the story. This is the experience of so many people. So many people are not going to, the doctor right now. They're choosing not to go to the hospital, choosing to skip out on dentist appointments and so many different things. And I'm not going to say that this has not been going on for a long time now, but we've seen millions of Americans lose their healthcare insurance after this past cycle and are planning to lose their healthcare in the next coming years, even as we see many of these massive cuts to things like the Affordable Care Act within the big, beautiful bill, guys. Like, this is a real life, and this is the scary part. Also, you got a massive amount of layoffs across the board, which is also causing so many people to lose their jobs as well, guys. This is insane, but let me know in the comment section below. She said she went to the doctor for a potential heart attack. All right, a pretty serious condition, especially if you were in this situation. If I was in that situation, I probably would have went to the hospital as well. But potentially a heart attack is what she said. Let me know in the comments, what do you think this doctor bill is gonna be? I'm gonna guess. I'm gonna just say, all right, I'm gonna be conservative. We're gonna say $5,000. All right, $5,000 is my guess. You let me know in the comment section below.
And he's here for emotional support. Oh, my heart is racing. It's just like, I don't know. I wanted to go to urgent care, but my fiance, bless his heart, was really scared and wanted to make sure we went to the hospital. Okay. Literally 1 week, 7 days after I lost my health insurance. All right, here we go. This was not the bill, but it is a financial assistance application. I will be filling this out. I do remember being in the ER and the nurses were taking my information and I was like in tears and I said, I literally just lost my insurance.
Okay, that makes sense. Okay, so she got a financial assistance video thing in the mail, which makes sense. And I really hope they were able to help her out because I ended up finding this video right here. All right, so my bad. I was looking around and I was like, okay, all right, this got to be a follow-up. So she got a financial assistance, support, whatever the case is, something in the mail. So, and that's the thing. A lot of hospitals do offer financial assistance, but let's see how much the bill is.
So I ended up having to go to the ER 1 week after my health insurance expired, and I posted a few videos on that, kind of telling the story. But my most recent video on this topic was a couple days ago, and I was asking you all for your estimates, your guesses on the cost of the bill. I am opening my portal now because I thought it would be fun to open that with you for emotional support. So here we go. Total is $8,093.34. I mean, I have nothing to say. Hopefully financial assistance will help me out and I'll be approved for that.
$8,000. $8,000. Are you kidding me right now, guys? And there are many different things at hand. Of course, many people say that, hospitals can lower the price on these different things, right? Like some of these things shouldn't cost as much, right? Like we point out and say all these different things. Doctors make a lot of money, but $8,000. Now, hopefully she's able to get financial assistance of some sort, right? Like something. 8,000. Most people don't even have $100 set aside to, for an emergency, let alone $8,000. That is ridiculous. And I cannot make this up, y'all. Like, this is how bad health insurance is within America. This is how bad it is when we talk about people losing their health care in America. Like, imagine if this was even worse than this situation, right? Like, she had a scare in terms of thinking that she was, having a heart attack. She had a scare. Imagine if she actually had one without health insurance. I can't, guys, this is scary. This is so scary. It's so bad. And, people ask me, what is the solution? The solution is you give Americans an opportunity to afford healthcare and not send them through some crazy portal and some crazy enrollment period where everything is $2,000 with a $20,000 deductible. That is the solution. That is the solution. I would love it if we had universal healthcare. I would love it. But of course, with anything that is free, there is also downsides to certain things, right? Like I said, it depends on the situation. But the fact that she has to pay $8,000 in this economy after, leaving her job and it is so bad.
Just cancel your health insurance. That's the answer. I've had the best health insurance for so many years. Since it's open enrollment, it is showing that I have to pay over $2,000 a month on health insurance. So I decided to actually do my homework for the first time because everyone has this scare like I need health insurance. And so I called the clinic where I have to do 4 scans every single year. And I wanted to know, what do you charge me cash if I had no insurance? This year I just went 2 months ago and the total cost was $465 that I had to pay out of pocket. I'm like, okay, maybe this is like a $15,000 service and I'm only getting it for $465. That's amazing. Want to know what it would cost with no insurance? The total is $550. Literally less than $100 difference. Meanwhile, I've been paying like $1,500 a month on health insurance. Just now it's going up to $2,000 because it's open enrollment. I called all my other doctors to see, do you take patients that don't have health insurance? They're like, yeah, of course. Some of them didn't want to give me their pricing until I said I might lose my health insurance and they had no option. I called primaries, gynecologists, pediatricians, eye doctors, the whole nine. Every single one of them, less than about $150 per visit. Health insurance is a scam. Get rid of it.
I just logged into my health insurance provider and I'm in the same boat as so many people. It's absolutely stunning what just had happened. In June of 2025, my insurance went from $125 a month to now $426.84. And now since it's open enrollment, it's unbelievable. I mean, I'm at a loss for words.